I'm Danny Davis. My guest is Bradley Briggs with Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. Bradley, welcome back.
Thank you for having me.
Brad, dental implants seem to be a big part of dentistry today. What's new about these implants?
Well, dental implants have just become an incredibly easier procedure than it was 15, 20 years ago. When dental implants first were introduced, they were doing experimental designs where it had to go all the way through the jawbone, or a long flat implant was placed into the jaw. And with new metals, with new coatings, dental implants have become a much simpler procedure. Oftentimes a tooth, if you have a tooth that's failing, the tooth can be taken out and an implant placed the very same day. With good bone density and structure, oftentimes a tooth can even be put onto the implant the same day, and it's just changed dentistry.
And what about color matching?
Well, color matching has come a long way too. Oftentimes you'll see someone and they have a gray line at the edge of the gums or at the edge of the tooth. And new materials, we are making abutments, which is a part that attaches to the implant and allows you to put a tooth on it. They're making those out of cubic zirconia, so it's a very strong material. It's a fake diamond, but they're milling that out and allowing us to have shades of white or some kind of light transmitting material that allows for a very natural looking restoration. So instead of having that gray line, it looks just like a white tooth coming out and transmits light the same way.
Can they be used for people who have lost multiple teeth?
Well, in the past, the only options that were offered were something removable, a partial denture that was removable, or a bridge. So oftentimes patients will be missing 2, 3, 4 teeth in a row. And with dental implants, we have the ability now to replace each single tooth with an implant, and that is fixed. You're able to bite an apple or chew into a carrot without worrying about, because it's very strong, and you can have bridge work for multiple missing teeth that works and feels like natural teeth.
So, Brad, are they stronger than the patient's original teeth?
That is a wonderful benefit to dental implants. In the past, if a tooth was questionable, it could have a root canal done to it, and you could go see a periodontist who cuts away gum and bone to get a spot where you can restore the tooth. So instead of going through gum surgery and root canals, having a dental implant put in, you cannot get decay. It's titanium, and once that implant is put into the bone, you can't have that tooth decay or the root break or the root canal fail. So a dental implant allows for a very predictable long-term restoration.
Thanks, Bradley.
Thank you.
My guest has been Bradley Briggs of Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona.